Speaker, the first duty of a responsible government is to protect its citizens. The Minister of Health's abysmal record over the past 18 months proves that this administration has utterly failed to carry out this sacred responsibility. Tens of thousands of vulnerable Albertans, cancer patients, children and pregnant women, and the chronically ill are at serious risk thanks to the lack of good leadership and management from the Health Minister and the Premier. Abruptly shutting down Alberta's immunization clinics when we still have hundreds of thousands of doses of vaccine available shows that this administration is panicking at a time when Albertans can least afford it. It's just the latest bad decision in a long line of them. For years, we and others have warned this administration that their mismanagement has left the healthcare system with no capacity to cope with a major crisis. Even on routine days, our major hospitals are at or over capacity, with not a single bed available. It's become normal for patients to wait in emergency rooms for days. For the last year and a half, this minister has sown discord and chaos throughout the public health care system. He dissolved the regional health authorities and the advisory groups, ADAC, the Alberta Cancer Board, with no transition plan and no evidence to base these decisions. He oversaw the unexpected termination of 3 medical officers of health last spring and the chief of the provincial lab early this summer, people who would have been invaluable during this pandemic. He denies our critical nursing shortage despite the evidence. We raised a red flag about the breakdown of management in August this year when my health critic wrote a 5-page letter to the Premier with detailed questions and concerns about preparation for H1N1. It took 2 months for this administration to reply with little more than an acknowledgement of the letter and a copy of some of the planning documents. Alberta has been unprepared for any kind of healthcare crisis for years, thanks to Tory mismanagement, and now the chickens have come home to roost. We have no surge capacity in our hospitals. Our system is already struggling to deal with the demands of a growing population and increased numbers of senior citizens. This administration has left the healthcare system in such a state that our healthcare professionals no longer have confidence and the capacity to deal with any large-scale disaster. Mr. Speaker, I implore this government to provide the necessary resources to immediately inoculate high-risk Albertans as quickly as possible. Open a sufficient number of well-staffed clinics to handle the load. Invite all available healthcare professionals, including students and retired professionals, to assist. As a physician myself, I would be happy to again offer my services to this. It's all well and good to talk about Monday morning quarterbacking, Mr. Speaker, but when the general manager is on vacation and the coach has no playbook, Albertans are left with little choice but to let their leaders know when they've dropped the ball. No more excuses.